Welcome to the video on the values that underpin Australia's healthcare system. This video is developed from the Unit 3, Area Study 2, Health and Human Development VCE Study Design. The key knowledge that is the focus in this video is the values that underpin the Australian health system, with also the key skill of identify and explain key components of Australia's health system. Now, the Australian healthcare system has 7 values that lay a foundation for its priorities and how it works to maximise its effectiveness. There are many acronyms that could be used, but this video will remember the 7 values by thinking of CARE SES. What does CARE SES mean? Let's go through it. The 7 values say that the healthcare system should be continuous. This involves the ability to provide uninterrupted, coordinated care or service across programs, practitioners, organisations and levels over time. Examples can include various healthcare professionals communicating to one another regarding their patients and the individual's access to various healthcare services for diagnosis and treatment. The A represents the value of accessible. This involves the ability for people to obtain healthcare at the right place and right time, irrespective of income, physical location and cultural background, providing healthcare to everyone no matter of race, religion or situation. The R represents responsive. This involves treating people with respect and having a client-orientated healthcare system. An example can include receiving immediate treatment in the case of an emergency, but the people should be at the centre of the healthcare system. Effective is the E, and this value means achieving desired outcomes in relation to the number of patients treated and the rate of improvement in a patient's condition. Various examples can include implementing things that work and discarding others that don't, and a cancer patient given a range of options to consider dependent on the individual case. So that takes us to the SES. The first S means safe. This relates to the reduction to potential harm from healthcare management and or the environment in which healthcare is delivered. Examples in the environment can include sterilised equipment that is provided when performing surgery. The E in SES is efficient. This involves the care, intervention or action that achieves the desired outcomes with the most cost-effective use of resources. Resources are limited, so it must be used in the best way to maximise benefits to the community. Last but not least, the 7th value is sustainable. This involves providing everlasting infrastructure such as workforce, facilities and equipment be innovative and respond to emerging needs. An example can include ensuring ongoing funding to guarantee the healthcare system can continue to evolve and develop. So there it is, the 7 values that underpin Australia's healthcare system. Just a quick little recap. We remember the values by using the acronym CARE SES. So continuous, accessible, responsive, effective, safe, efficient and sustainable. So hopefully this information covers the key knowledge of the values that underpin Australian healthcare system and importantly for you as a student to obtain the key skill of identifying and explaining key components of Australia's health system.